Gallium-68 PET scan for neuroendocrine tumors. What to expect. Hello, this evidence-based content is prepared by Saboor, fellowship-trained consultant surgeon, and if you or someone you care about has been diagnosed with a neuroendocrine tumor and your doctor has mentioned something called a Gallium-68 PET scan, you're in the right place. I know medical scans can feel overwhelming, especially when they involve unfamiliar technology and radioactive tracers, but today we're going to demystify exactly what this scan involves, why it's become the gold standard for NETs, and how the results shape your treatment options. Gallium-68 PET scanning, often called 68-gay dotatate or 68-gay-OTATOC PET-CT, is a specialized imaging technique that has revolutionized how we diagnose and manage neuroendocrine tumors. Most NETs have special proteins on their surface called somatostatin receptors, particularly subtype 2. Think of these like molecular docking stations. The Gallium-68 scan uses a radioactive tracer that binds specifically to these receptors, lighting up NET cells wherever they are in your body. This matters to you because, unlike conventional scans that just look at anatomy, this scan shows us the biology of your tumor, where it is, how active it is, and crucially, whether it will respond to certain treatments. The Gallium-68 PET scan has replaced the older Octreoscan, technically called indium-111 pentatriotide scintigraphy, as the method of choice in an increasing number of centers because of greater diagnostic accuracy and lower radiation dose. According to meta-analysis data, the sensitivity of the older Octreoscan for NET detection is 60 to 80%, with a specificity of 92 to 100%. Gallium-68 PET provides substantially better performance, particularly for small lesions and challenging locations. The scan offers better patient convenience, since imaging may be performed 60 minutes after injection, compared to 24 to 48 hours for the older scan. That's the difference between a same-day procedure and coming back multiple times. If you're supporting someone through this, that practical advantage reduces the burden on both patient and family. Gallium-68 PET-CT detects lesions that conventional imaging misses, particularly in 3 critical areas. Bone metastases that are often missed on CT are much better visualized. Lymph node metastases that are not possible to characterize on CT or MRI based on size alone can be diagnosed definitively when they show tracer uptake. Visualization of small peritoneal lesions and primary small intestine NETs is facilitated by this technology. It means your doctor gets a complete picture of disease extent on a single scan, rather than piecemeal information from multiple different tests. The research demonstrates that this comprehensive staging changes management in a significant proportion of patients. The Gallium-68 PET scan serves a dual purpose. Firstly, as the majority of tumors express somatostatin receptors, it is valuable for diagnostic workup and staging with high sensitivity. Secondly, non-invasive visualization of somatostatin receptor expression helps determine whether you are suitable for targeted. PRRT is a type of targeted cancer treatment that uses radioactive substances to deliver radiation directly to cancer cells, with lutetium-177 dotatate or other receptor-targeting treatments. Recent evidence suggests that somatostatin receptor PET imaging results are highly correlated with receptor expression on tissue analysis, but are more accurate for predicting individual prognosis. If your scan shows strong uptake, typically measured as uptake greater than liver or equal to spleen, you're likely a good candidate for PRRT, a targeted radiation therapy that's shown significant benefits in clinical trials. If you're worried about someone you love with metastatic NETs, a positive Gallium-68 scan opens the door to this treatment option, where conventional chemotherapy might have limited efficacy. Preparation requirements are straightforward but important. There is no need for fasting prior to somatostatin receptor imaging. This distinguishes it from other PET scans you may have heard about. You can eat normally before your appointment. If you are on somatostatin analog treatment like octreotide or lanreotide, discuss timing with your doctor, though for diagnostic scans this typically doesn't need to be stopped. Gallium-68 dotatate is administered intravenously at approximately 2 megabecquerels per kilogram of body weight as a bolus, and PET-CT examination is performed 60 minutes after injection. The highest NET uptake occurs approximately 70 minutes following injection, so the timing is optimized between tumor uptake and image quality. You will be asked to void immediately before the scan. The actual scanning time is approximately 20 minutes, covering from base of skull to proximal thighs, with 3-minute acquisition per bed position. The radiation dose from Gallium-68 dotatate/tate to a 70 kilogram patient is approximately 2.9 millisieverts, which is substantially lower than the 12 millisieverts from the older Octreoscan. To put this in perspective, that's roughly equivalent to a year's worth of natural background radiation. If you're already on treatment, have specific questions about whether your current medications need adjustment before scanning. For instance, patients on hemodialysis should discuss the feasibility of the examination procedure with nephrologists and radiation protection experts, typically involving imaging after dialysis. Ask your doctor about the uptake grading system. Visual grading scales compare tumor uptake to normal organs. Grade 1 is lower than liver. Grade 2 equals liver. Grade 3 is greater than liver but less than or equal to spleen, and Grade 4 exceeds spleen. This grading directly impacts PRRT eligibility, with higher grades generally indicating better treatment candidacy. For family members supporting someone through this, ask about what the results will mean for treatment options. Will a positive scan mean starting PRRT? What if uptake is heterogeneous, meaning some tumors light up strongly while others don't? These are important conversations to have before the scan so you understand the next steps. Gallium-68 PET may be used for therapy response monitoring. If you've started treatment, your doctor may recommend repeat scanning to assess whether tumors are responding, progressing, or stable. This becomes part of your ongoing surveillance strategy, particularly if you're on PRRT or somatostatin analog therapy. The frequency varies based on individual circumstances, but understanding this upfront helps you plan. Timeline expectations matter here. Results are typically available within a few days to a week. The images are reviewed by nuclear medicine physicians in conjunction with your oncology team. If this applies to you, don't hesitate to request a follow-up appointment specifically to review the scan images with your doctor. Seeing the scans yourself can be helpful for understanding your disease. Gallium-68 PET scanning represents the current gold standard for imaging neuroendocrine tumors because it combines superior detection accuracy with direct assessment of treatment eligibility. Your next step: discuss with your healthcare team whether this scan is appropriate for your situation and what the results will mean for your treatment pathway. This information is for education. Always discuss your individual situation with your healthcare provider. I've outlined several reputable resources here that you may find valuable for further information on this topic. All links are available in the description below. Thank you for watching.